Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith Rogers. Today, the impact of surprise federal budget cuts on a state health department. Dr. Manisha Juthani is the health commissioner of Connecticut. She speaks to Dr. Josh Sharfstein about the recent decision by the U.S. Department of Health and Human Services to abruptly stop $11 billion in state grants that were provided as part of the COVID response. Just a note that this episode was recorded prior to a federal judge's issuing of a temporary restraining order on the cuts. Let's listen.
Dr. Manisha Juthani, thank you so much for joining me today on Public Health on Call. How are you doing today?
It's been a rough day in public health.
It sure has. It's been a rough few days in public health. What is top of mind for you today?
Well, we had almost $150 million cut last week in critical funding that was helping to support public health initiatives for the people of Connecticut.
Tell me more about that. What kind of initiatives?
So we had funding in 6 different grants, all of which were canceled effective immediately. And the types of programs that were funded involved setting up laboratory systems that help show people cases of flu and RSV and COVID, immunizations, and the like. And all of those updates have had to come to a halt.
So I want to take a step back to understand what Connecticut was working on with these federal funds and what you're losing as those funds may go away or have gone away. Take me back to the pandemic. You became health commissioner in the middle of the pandemic. What were the systems that were straining or failing within public health that you became aware of?
Everybody knows and remembers back to the early days of the pandemic that people wanted to know how many people had COVID, how many people had been tested for COVID, where were more cases coming up. At the beginning of the pandemic, everything was really facts-based in the state of Connecticut.
And wait, just to be clear, when you say facts-based, do you mean FAX, like a fax?
As in a fax machine.
Okay.
Meaning lab results were sent to the department by those fax machines, and paper had to be collated, data put into systems to be able to try to answer those questions that actually were guiding public health decision-making at the time.
So people were pulling the faxes off the machine and typing in the data into some database somewhere.
And if we were really state-of-the-art, it might be an e-fax, where it wasn't actually a piece of paper. So it varied, but yes.
And what were the consequences of those challenges?
So we all are used to a technological world where those types of delays are beyond what people really expect in the United States of America at this point in time. And this funding really helped us get our systems slowly getting up to speed. We had to focus on that initial COVID data initially. But what the pandemic highlighted for us is all the gaps that we had in our systems throughout public health. And that's what we'd really been working on over these last couple of years.
Let me ask you this question. People are going to hear about fax machines, the people who remember fax machines, and go, come on, why didn't you solve this before? Why couldn't Connecticut have solved this before?
So we did solve it in certain areas. But what is very complex for people to see is that some of our data is long genetic codes. You need systems that can manage that kind of data. We have personal private information and data security issues that need to be dealt with. We need the infrastructure, actual cables that can actually manage the level of data that we're looking at to be able to send. So we've most certainly made advances, but we hadn't quite gotten over the finish line. And that is what we were finishing up.
Right. So for many years, would you say there wasn't adequate funding to modernize the system. And then you got to the pandemic and funding became more available and you could accelerate this work?
Absolutely. That is part of what happened in the pandemic, which is to say that some of these systems were extremely delayed, had not been updated for decades, and those types of investments were lagging. But our government did realize that, and that's why funding was put towards it. And to be clear, millions and millions of dollars have already been spent of taxpayer federal dollars to get us to the point where we are now, only for it to be paused right now.
That sounds especially frustrating.
I think it is frustrating because we know that we can do better. And we know that we were almost there. We know that we had done the hard work to make sure that the systems that, for example, would allow a newborn who's born in the state of Connecticut and has over 60 genetic tests done to get reported back to their provider quickly, efficiently, to try to catch genetic tests that need to be diagnosed early. And we're still working on faxes with some of those. That's the kind of upgrade that we were really hoping to be able to roll out across our agency, not just in one specific area.
Got it. So this would have made test reports much more accessible. And so you can give a quicker update on the status of an infectious disease, but also newborn screening and other kinds of data so that it's more easily accessible, but also you can do better quality control and make sure that the patients who need to be found can be found.
Absolutely. And that's just one part. The disease surveillance, actually having epidemiologists who can identify where infectious disease outbreaks are going on is another part of it. And then the third part is actually tracking immunization rates, identifying pockets in our state where immunization rates may not be as high. With over $6 million that were with our local health departments who could try to fend off any outbreaks that might happen or could happen. And that was terminated at a moment's notice to all those health departments as well.
Does that make Connecticut, say, more vulnerable to a measles outbreak, do you think?
That is exactly what we've been worried about. We know, for example, in Connecticut that we have a 97.7% measles, mumps, and rubella vaccination rate for kindergartners. However, we also know that we have schools where that rate is lower. We have a public-facing dashboard, in part supported by funds through these types of grants, that allow us to show the public where rates might be lower, where we want to focus those immunization efforts to make sure that we don't have a measles outbreak in Connecticut. We don't have a case yet, and we're trying to keep it that way.
So you're in the process of making all of these upgrades and delivering these services. The funding gets cut. Before you tell me how that happened, I want to just go back. Tell me about the source of funding.
So the source of funding is from the Centers for Disease Control. And 4 of them were grants related to enhancing our laboratory systems. 1 was an immunizations grant, and 1 was specifically on health disparities. And all 6 of those were terminated.
And was the funding made available through the pandemic funding?
So they were originally allocated as pandemic COVID-related funds, but different than what is being purported in the media, these were not COVID funds anymore. We had been authorized by the CDC to redirect funds to be able to fill holes that were clearly identified in the pandemic that made our response very challenging the first time around. And now we were making our systems better to be able to serve the people of Connecticut better.
And how do you find out the funds were getting cut?
We had notices issued, close of business on March 24th, and on March 25th, we were notified as leadership that these notices were coming in. So they had already been terminated by the time we had been notified.
And that meant no more money could go out the door?
So it is our impression that expenses we have before March 24th, we can still draw down. And it does appear that those funds are still available to us at this moment in time. However, any expenses beyond March 25th would not be able to be drawn down.
It's kind of hard just to shut off programs.
It's extremely hard to shut off programs. You know, our health disparities grant, one of the programs that it was funding in Connecticut is one called Family Bridge, where we have a universal nurse home visiting program for new families, new mothers who just gave birth to a baby, where they could be visited by a nurse and or a community health worker. And we were one of 3 funding sources. I had to let 2 of my sister agencies who were doing this work know that they could not use this source of funding any longer going forward. So these programs that were really built to make significant impacts in the lives of new families right in our community had to get stop work orders, like we had to do with over 69 contracts, over 50 contractors. And we are doing the hard work now of trying to identify what we can save within our department.
Is it possible that there were people who are expecting a home visitor to come the next day who might not have been able to come?
It's very possible. You know, we're not running that program. We were funding the program. But I also know there was work looking at how this program was going to be sustainable. There was work looking at what is the impact this program has had so far in Connecticut. And all of those contractors had to get stop work orders. So there may be work still going on, but there are definitely people who may have had to be told that they could not do that work anymore.
Now, I understand that a number of state attorneys general, including the one in Connecticut, are filing a lawsuit about the loss of this funding so abruptly. Can you tell me anything about that?
That's correct. The lawsuit was filed today, and we look forward to hearing the outcome of that. The basis for the lawsuit was that there was not good cause for these terminations, and we await to see what the judge says.
Dr. Juthani, thank you so much for joining me to tell me about this development, and please keep me posted.
Thanks so much for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Cesiri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Cesiri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.